Hello and welcome to another episode of the Med Madness podcast, your go-to source for essential medical knowledge. In today's episode, we're tackling a very serious and often overlooked issue, elder abuse. We will explore the risk factors, manifestations, and ways to recognize and address this critical problem. Understanding elder abuse is vital for healthcare providers and anyone involved in the care of elderly individuals. Next, let's discuss the risk factors for elder abuse. Elder abuse can occur in various settings, but certain factors can increase the risk. First, demographic factors. Being female is a significant risk factor. Now, let's move on to health factors. Dementia and chronic mental illness are key contributors. Functional impairments, which can make elderly individuals more vulnerable, are also important. And now, social factors. Social isolation increases the risk of abuse. Living in a shared environment, especially with non-spousal individuals, can also be a risk factor. Additionally, poor socioeconomic status and financial stress can contribute to the likelihood of abuse. Next, let's explore the manifestations of elder abuse. Elder abuse can manifest in multiple ways, starting with physical and sexual abuse. Look for atypical abrasions, lacerations, contusions, and fractures. Pain that doesn't match the reported cause can also be a sign. Anogenital injuries and newly acquired sexually transmitted infections, or STIs, are other indicators. Moving on to psychological and verbal abuse. Sudden changes in behavior or personality, as well as signs of depression or anxiety, can be manifestations. Next, let's discuss neglect. Inadequate nutrition or hydration, pressure injuries or bed sores, and worsening of existing medical conditions are signs of neglect. Finally, financial exploitation. Failure to adhere to medication regimens, multiple missed medical appointments, and unpaid expenses or rent payments can all be signs. Let's consider a real-life case study. An elderly woman with dementia living with multiple family members comes to the clinic with an orbital fracture and multiple bruises in various stages of healing. She also reports that she had to stop her long-standing medications because she couldn't afford them anymore. Upon further investigation, it was discovered that her finances were being diverted by family members for their own use. This patient exhibited multiple risk factors. She was female, had dementia, and lived in a shared environment. Her injuries and sudden financial difficulties were clear manifestations of abuse. Elder abuse is a complex issue with various risk factors and manifestations. Recognizing the signs is crucial for timely intervention. Remember the key points. Elderly women, especially those with dementia or mental illness, are at higher risk. Abuse can manifest physically, psychologically, through neglect and financial exploitation. Encourage your listeners to engage with the pre- and post-podcast quizzes to test their understanding and to use the Anki flashcards for effective study. Stay informed, stay vigilant, and help protect our elderly population. Thank you for listening to Med Madness. If you found this episode helpful, please share it with your peers and tune in for more insightful episodes. Until next time, take care and stay informed.